So you mentioned vulnerable populations, and obviously very important because they're more susceptible to waterborne illnesses and the contaminants that could be in drinking water. But can you tell us a little bit about how the EPA, the Environmental Protection Agency, how they really set regulatory standards for how we should, maintain the quality of our water, and how are vulnerable populations considered when regulations are set for how clean our water needs to be?
Well, traditionally, we've looked at finished drinking water, so as it leaves the water utility, and looking for different levels of microorganisms or disease-causing microorganisms, such as pathogens in the water, and having some benchmarks or thresholds for concentration amounts that should not exceed certain levels. In terms of human health, though, we can take a risk assessment approach where we translate the numbers of organisms that can be found in water to predictions of human health impacts, such as what are the chance of an infection or illnesses if someone's exposed to that quality of water. And then human health risk benchmarks can be established, and that's what the EPA looks at in terms of establishing guidelines. So in terms of, forgot your other question.
Just how that might relate to vulnerable populations. I mean, when we set regulatory limits for how clean our water needs to be, are we considering the most vulnerable populations in those limits?
We are. And so historically, those more sensitive populations did set the threshold, if you will, for the human health benchmarks. In more recent years, the EPA has taken a slightly different approach where we're calling those populations as just really being in normal life stages, right? So we've all been a child once, and we hope to live a long time and reach the elderly category. And as I mentioned before, with medical advances, people are living longer, and they are living with certain underlying conditions. It's considered more of a normal life stage as opposed to a worst case scenario for the vulnerable populations. And I think that approach has provided more protection for the general population.